Hold on, Carrie. Hold on.
Okay.
Go ahead, sir.
Okay. Welcome to Thurston County Board of County Commissioners. We have a special session today. Our Treatment Sales Tax Advisory Committee meet and greet, it's called, but we're actually going to talk about some substantive topics as well, I believe. My name is Ty Manser, Chair of the Board of County Commissioners. Commissioner Vice Chair Gary Edwards is present. I see County Manager Marilyn Roberts, and you said Commissioner Mejias will be in the boardroom shortly. Director of Public Health and Social Services, Shelley Slaughter, and our Program Director for Treatment Sales Tax, Carrie Pinnan, and then our illustrious crew of advisory committee members. And I'm not going to go through them all because we'll probably do introduction round, Carrie. So I'll leave that for that. And Ramiro, should I turn it to Carrie, or do you have something to introduce?
I believe this is an annual briefing for you the board to have an opportunity to have a conversation with the members of the Treatment Sales Tax Committee, great volunteer of experts. They guides through the board in making some funding decisions related to TST allocations. So, Carrie, I don't think we have the specific format, but go ahead.
Okay, thanks. Thanks everyone for being here, including Assistant County Manager Campbell, who I don't know if you got mentioned. Okay, so the committee appreciates hearing from the county commissioners, and we are losing some committee members right now. The county commissioners have just appointed some new members, so I thought this was a good time to for everyone to kind of get to know each other. So I thought it would make sense to start with a round of introductions. There are many folks on this call, but all with really great backgrounds, interesting connections to TST. So I thought we could go through those introductions, and then I did send a couple questions that hopefully you all have seen. I know this is informal, not expecting you to have prepared, but hopefully we can talk about a few things. So I guess I'll facilitate calling on people, kind of going around the Zoom. So starting with Stephen.
Good morning, everyone. My name is Stephen Thompson. I have been on the advisory committee just a year, so just starting my second year on the body. Really excited to kind of, how can I put it? You've been around the block once. It gives you a much better sense of what's coming around in the process in the coming year. So I'm really pleased to be on this body. My background is actually training as a cultural anthropologist, so I'm really sort of interested in and thinking about complex social systems and how they interact. Certainly a key part of what this body does. And I currently work for the state auditor's office as a process improvement specialist. So very much engaged in thinking about performance measures and performance-based budgeting and the smooth flow of information among partners in complex processes. So all things that touch on the work of this committee. Thanks.
Thanks. Shanita.
Good morning, everyone. My name is Shanita Jackson. I go by she, her pronouns. I am currently the program director within the Washington State Department of Commerce, Office of Homeless Youth. I have 18 years experience in supporting, serving, and advocating for nonprofits and for-profit organizations supporting vulnerable populations. So that includes everything from youth to families to singles, veterans, and seniors. I currently have been with the state for 13 years. I'm very excited to be on this body and offer any expertise that I can to ensure that communities of color are raised and prioritized around.
Thanks. Wendy.
Hello. So I'm Wendy Tanner. This is started my third year on the Advisory Committee, and I have 25 years working with youth and adults, both in child welfare, runaway and homeless youth, employment, all kinds of programs for youth, and then in mental health, both drug and alcohol and mental health service delivery. And I currently work at the University of Washington School of Social Work with the Alliance for Child Welfare Excellence.
Thanks. Bob J.
Oh, good morning. My name is Bob Jones, and one of the things that I'm known for is veteran activity. So I'm a veteran advocate, but having been retired from the Army and retired from my business, I found myself wanting to get involved in the nonprofit world. And so for the last 5 years, I've been the president of the board of Thurston County Veterans Services, which is a charitable nonprofit run by all of us volunteers, totally volunteer. We have no employees. For the last 5 years, we've been supporting veterans here in Thurston County. I'm proud to report that we just had a year-end report, and we spent last year $20,000 in this county to help veterans. That money was donated by corporate sponsors. So I decided to get involved in the treatment.
You went on mute, Bob.
That,
Oh, there we go.
I know about my volunteer activity was in support of the Veterans Court, which, by the way, is working very well for veterans here in this community. And I thought, well, let's find out more about this treatment sales tax. So I'm happy to have the opportunity to help. I think I'm either starting my third year or ending my second year. I'm not sure which, but one of those two. And I've been around Thurston County for the last 30 years or so, and I've been working as a veteran, either myself or with veterans, for over 50 years. I would tell you that since I just turned 21, that makes for a difficult way to explain myself. I'm happy to be here, and thank you for the opportunity.
Thanks, Bob. We'll go to Bob A., who, along with Safira, are two very, very newest committee members, not even officially committee members yet, appointed by the board a couple days ago, effective in March, but still managing to give up half their day to jump in. So Bob A., go ahead.
Good morning. Good to see you all. Very nice to meet you all as well. I'm Robert Almada. I'm currently serving as the interim chief of police for the city of Lacey, and have been doing that since about May of 2020. Let's see. I got about over 30 years law enforcement experience at this point. Majority of that down in Southern California for the city of Santa Monica. Started about a third of my career actually working undercover in various capacities, which gave me the opportunity to basically enter homeless populations and really get a ground view of homelessness and mental illness, and kind of gave me a passion for this type of work to find alternative solutions other than the criminal justice system for addressing some of these needs in vulnerable populations. So thank you so much for the opportunity, and look forward to working with you all.
Thanks and welcome. And Marilyn.
Hi, I'm Marilyn Roberts, and I am actually, I think, starting a second term. Correct me if I'm wrong on that, Gary. My background is in healthcare. I worked for healthcare for about 30 years. I retired from Providence in 2017. While I worked in healthcare, I started volunteering for the National Alliance on Mental Illness. Fast forward, that brought me into 2018, where they offered me a position. I'm now the director of operations. As you know, not the National Alliance on Mental Illness is a national organization that brings education around mental health and substance use to the public. The largest grassroots organization in the world at educating about mental health. And one of my newest adventures is I joined the Governor's Advisory Board on True Blood. And so I've spent a lot of time on that lately and working with the legislature. So thank you for letting me go again.
Thanks. And in the twilight of his TST career, we have Glenn, who is still on mute. Glenn, you're still muted. All right. Oh, there we go. There we go. Yeah.
I said, regardless of what it says on my name tag, I'm not Veronica. She allows me to use her computer. But I would like to thank the commissioners for the opportunity to have served on this board. When I first heard of the board, I thought I'd bring a little expertise in the veterans area because I'm retired military, 25 years. I had 20 years of law enforcement, 11 of it in the great city of Yonge. And then working with Lieutenant Governor, being Chief of Staff for Lieutenant Governor Brad Owen, I was able to bring a little bit of what's going on in our state. But the reason I decided not to extend in the board, we need to bring new expertise of what's going on in the area of law enforcement. And that's why I went out and tried to recruit folks. And knowing Bob, what little I did, Robert, I thought that was a person that would be a great fill. And I'm thanking you for putting him in the position. I know we're not supposed to say this, but as an outgoing person, I can say pretty much what I want to. I'd like to tell the commissioners how much Carrie means to this committee. I wish you knew what she brings to bring in this group of people we have here, wide spectrum of personalities, expertise, and she's molded us into a team. And I hope that continues to go. And if it does, it's all because of Carrie. I've worked for a lot of boards in my last 40 years, and I can say I've never had as much fun and appreciated a person as much as I do Carrie. Thank you, Carrie.
Well, geez, thank you. I'm glad I took you off mute. Jeez. Gina, go ahead.
That was very sweet. But yes, my name is Gina Thompson. I use she, her pronouns. I have clocked 2 years. Yeah, 2 years with the treatment sales tax. I currently work as a program manager for the Office of Homeless Youth. Prior to that, I was over at the Behavioral Health Administration, Maple Lane Competency Restoration Program. I've been a resident of Thurston County for almost 2 decades. So I think I got to be, Bob, you're 21 years of age. Yeah, so I'm just grateful to be here. Not everybody gets a seat to the table, so an honor. Thank you.
Thanks, Gina. Safira, also our other newest committee member, 2 hours into her TST study now. Go ahead.
Yeah, hi, I'm Safira Madrone. I have been working as a mental health counselor and substance use treatment provider for about 4 years. And then before that, I have been working in the community, crime victims advocate, case manager, program coordinator in a variety of different programs. So I'm excited to be here. It's clear there's a lot of experience in the room here, and looking forward to learning from everybody and being able to share what I can.
Welcome. And Priscilla.
My name is Priscilla Terry. I'm a retired commercial real estate agent and business owner. And now I've decided to take a new direction. And I'm interested in finding programs that can prove themselves to help the people who are not at their most productive levels right now to get back into the mainstream and become productive, responsive citizens. Thank you.
Thank you. So I think that covers all of our current and oncoming committee members. The one other committee member who is still a committee member for 1 more month, but decided he was 1 foot out the door is Skip Steffen, who has served for 6 years since the inception of this committee. He's also the director of the Union Gospel Mission. So he's got a full plate, had other things going on today, but we sure appreciate his service. And then I will recognize Jim Stanton, a former member of this committee and now a member of the public.
Yes, just observing today. I'm a 5-year member of the committee. The last in-person meeting was my last meeting with the committee. Yeah, and I'm currently retired and working with the homeless in programs in the city of Lacey. And currently there's a virtual open house or town hall that they're advertising. So I'm working on that. I'm part of that committee.
Great, thanks for being here. I still have a TST coffee mug on my desk at the Public Health Building that I was going to give you at our March, what would have been the last in-person meeting in March 2020, but I'll get you that coffee mug one of these days.
Well, hopefully you'll have in person here in the not, right?
Right, yes. Okay, so would we like to, commissioners and county leaders, do you guys want to introduce yourselves and then we can move into the couple of questions that I sent? Does that make sense? Yeah, Commissioner Menser, you unmuted, so go for it.
Okay, well, I'll just facilitate the county side. Let's go with Commissioner Mejia, our newest commissioner.
Hello, everyone. It's nice to put a face to a name. It's a pleasure to meet all of you. My name is Carolina Mejia, and I'm the Commissioner for District 1. And I am new. It's my second month in. So be gentle with me on the questions.
All right, Commissioner Edwards.
Yes, I'm just starting my second term as a commissioner, but I've got a long time background in law enforcement. And, you know, I mentioned earlier, we as the Board of County Commissioners interact with well over 40 different groups. And I know you've got questions about different things that you want to talk about. And traditionally, we haven't given advice to those groups that we appoint members to. We depend on that group to bring their expertise, and that's the one of the important reasons to have that diversity, is so that you can bring information to us as to what you see through your own individual fields as the need as we move forward with your particular endeavor, whatever that is. So I'm looking forward to the discussion. Thank you.
Robin Campbell. Introduce yourself to the group.
Good morning. And I want to say just how wonderful it is to be here with the committee today. I've been somewhat involved in the committee for 11 years now, since the advisory committee's inception, and the work that you do is pretty amazing. My role in the county is assistant county manager, and I am mainly responsible for the county's budget. And the work that your team does to inform the budget process and how we use the resources that we collect in treatment sales tax revenue is just invaluable to the process. So thank you for spending your time thinking about the county and working on all the wonderful things that we can do together.
County Manager Ramiro.
Thank you. Ramiro Chavez, County Manager. And since I've been in this particular position, my tenure, I have learned to appreciate the value the TST Advisory Committee brings to the county government. And just listening to the diverse background, the expertise that you bring, it just brings validity to the recommendations that you provide to the Board of County Commissioners on a yearly basis. And I just have to tell you that we have a lot of committees and a lot of feedback the board receives. And I can tell you how much the board appreciates your perspective. It's professional, it's well thought out, And the objective that you have is how we, the board, can fund the projects and programs that brings value to the community. And from that point of view, I really appreciate everything you've done and you will continue to do.
Shelley.
Good morning, everyone. Shelley Slaughter, Director of Thurston County Public Health and Social Services. And it is always a pleasure to get to be a part of the advisory committee meetings. Since TST became a part of our department a few years ago, I've had the chance to get to know some of you, and many of you I've worked with in the community in other capacities over the years. And I just never cease to be amazed and impressed at the expertise and experience and commitment and dedication that you have to our county and to our community, and what a difference you make. And also welcome to the new members, and I look forward to getting to know all of you better. Thank you.
Okay, thanks, Shelley. And I guess I'm last, and my name's Ty Menser, Commissioner for District 3, and I have a background in criminal defense. I was a lawyer before a commissioner, and I, after 3 years of commercial litigation, intellectual property litigation, I went to Alaska to be a public defender, where I worked for 7 years there, in first in the Arctic, and then in Fairbanks, and then came to Thurston County in 2007 and joined a small law firm and did private criminal defense work, public defense, overflow, contractual work, and family law. So that was kind of where I came from. So I have an interest in all things criminal justice, and I'm the county's representative on the Law and Justice Council, but I also attend a bunch of anything criminal justice related, whether it's assigned to me or not. I attend the opioid task force meetings. I attend the innovative justice meetings. I've been in a series of meetings and regarding creating a resource hub for the county. I meet monthly with the prosecutor, the public defense director, and the sheriff on criminal justice reform topics. So I'm very interested in all of the issues that you guys deal with. And just kind of echoing what Ramiro said, this group I've never seen a group that's done some of the things that you've done in terms of last year in our budget was my first year of actually building a budget, because when I took office, this is my 3rd year, and when I took office, the biennial budget had been built the previous fall. So this past fall was my first chance to build a budget. And when we got to the TST programs, your recommendations were not only thoughtful about where to, everyone's got good ideas sometimes about where to spend more money, but you guys actually had ideas about where to spend less money, which isn't always the easiest thing to do, but I can't emphasize how valuable that was to us as commissioners, because we would never be able to get to that level of detail in those programs and how they're working in order to say, hey, maybe this money could be deployed better over here and a little bit less here. I mean, that was impressive to me, and almost to the T, we backed those recommendations and appreciated them. So thank you. I'm going to turn it back to Carrie for kind of facilitating the rest of this discussion.
All right, thanks everyone. It is an impressive group. So I'm going to credit Priscilla for a moment. Last month, the advisory committee, we were meeting, and I said, oh, we should prepare for when the commissioners come for a meet and greet. And Priscilla said, meet and greet? I want meat and potatoes, not meet and greet, which I thought was just the funniest little pun. So we're now on from the greet to the potatoes portion of the program, I guess. So the group had brainstormed a kind of 3 questions, and the first one really is the $8 million question, or whatever TST is now, which is, does the board have, as we sort of look ahead, finally wrapping up the last budget process, but already thinking about the next one, as we look ahead, does the board have areas of priority areas of focus that you would want to direct this committee to look at? And I appreciate Commissioner Edwards' comments that actually you want the advisory committee to advise you on that topic. which totally makes sense. And I think there is sort of a chicken and egg question. So I think even that comment is helpful to the committee. But one other piece of context I would provide is I'm thinking back to when I presented on behalf of the committee at the board budget sessions, I think in October. And Commissioner Edwards, it was you who said something like, well, my real priority is, you know, reducing our jail population. So I want to fund programs that do that. And I think the reaction from some of these committee members was, oh, was that our number one priority? We should have talked about that 5 months ago if it was. So if there are kind of headline priorities where you as commissioners are saying, our number one thing is keeping people out of jail, or our number one thing is supporting youth, or whatever, I think this committee would love to know it. And I think they also would appreciate the perspective of, actually, we need your expertise to figure all that out. So that's my long tee up of the $8 million question. And I guess we'd love to hear from the commissioners on that.
Okay. I can start if the commissioner, I don't know who wants to start on this. Commissioner Mejia, did you have something to start off with?
Well, I think, I don't know if we're all even going to be along the same lines we are. We think we have different priorities and terms. So I don't know. For me, I don't mind going first, Commissioner.
Okay, go ahead.
For me, I mean, behavioral health is a big thing for me. I come from the courts. And so I've worked with the courts for 5 years and before that. So I've been at every level. I've been at federal court. I've been with the states, and now I was with the Superior Court for 5 years. So having that background in mind and seeing the amazing work TST has done, you know, for me, we're seeing that in our community right now. It's behavioral health and how we can support our youth early on with that. So as you know, they grow up and they're going through life, it's better coping, better mechanisms to have there to support. So that's a big thing for me. And of course, always the reduction of jail population. You know, that's always a priority for me. How can, especially with the backlog we're seeing now, we're seeing that really those low income people are the ones who are having to stay in jail and waiting for those long time when before their case gets processed. So that's me, Commissioner.
Okay, Commissioner Edwards, anything on this one?
Well, I guess I would say along with that, you know, cutting back on that jail population, it goes back to, I guess, a larger philosophy of accountability. And we probably need treatment to get these people back on their feet. I'm not much for just giving away money to address a problem. I'm all for giving a hand up rather than a handout. And that kind of fits from my perspective. But I would say that I don't know that all of us have the same philosophy. And it's hard for a board that hasn't discussed what their priorities might be to try and give a group direction. And that is why I like to depend on the group to bring together that diversity of experience in life as to what they think the solutions are. And in the end up with community doing better because of it, and individuals doing better because of it, and getting back on their feet and becoming productive members of our society. So that's kind of where I'm at.
Okay. So a little perspective just on where I come from. So when I was running for office in 2018, I learned that, I don't know where I got the stat, but I had the stat that 45% of folks in Thurston County Jail had a mental health diagnosis. WASAC, the Washington State Association of Counties, is promoting a bill right now And in that bill, they've given some background, and WASAC is usually pretty careful about the information. They're not, they don't make wild, unsubstantiated claims. Their bill background report says that, and again, they're speaking statewide, that I think it was 63% of folks have a serious mental health condition diagnosed. Now, so I don't know how that, I don't know if we've gone, I don't know if that's out of whack with Thurston or if the problem's gotten that much worse since 2018. But if that's the reality statewide, then I know that it's something similar to that here in Thurston County. So there's that, and then there's the 75, 80% of folks in jail have a substance abuse disorder. So when I take those two statistics and I look at our jail and what we spend to incarcerate, it's just my philosophy, my strong conviction that incarceration is a tool that has to be used in some cases, but when someone's struggling with a health problem and that problem is driving the behavior, I don't think incarceration is a good use of resources. So I'm always looking for ways to, I think the public will spend money on criminal justice, that's been proven, but they want to get public safety result out of that, making people's lives better, reducing crime, stopping cycles of recidivism, all of those things. And I don't think incarcerating mentally ill and drug addicted people does that. So I'm always looking for better ways to deploy the limited resources that we have in the county. The specifics of that, I rely on groups like yours to recommend programs and look at programs and see how effective they're being and make recommendations as to how we can shift money around or do better. But that's my driving ambition. It's not to reduce jail population just to do it, just because I don't believe in incarceration at all. I just think that if that, you know, those statistics to me are mind-boggling. When I didn't, and even though I've been a criminal defense lawyer for a decade in Thurston County, it wasn't until I started running for office and looking into the stats that I heard that 50% of our folks in jail are mentally ill. I mean, that was an epiphany for me that we've got to start doing something. We're just wasting taxpayer dollars, in my opinion, to incarcerate mentally ill. So with no treatment connected to it. So whether it's connecting treatment to folks in jail, re-entry, some research that I've looked at shows that re-entry services are very cost effective in terms of what you get for what you spend. So I'm wide open to approaches, but that's what I'm looking for, are trying to attack that, what I see as a real inefficiency in our system.
Thank you. So Marilyn put in the chat, Commissioner Mentzer, I don't know if you know the bill number that you were referencing, the WASAC data.
Well, the bill number, the bill was actually not particular. Yeah, so the bill was about allowing people who are in jail for short stays up to 30 days to keep their Medicaid.
Yeah, it's a Medicaid is to request a proposal. Yeah.
But it was WASAC's, like, it was the background information in their report as to why they were supporting that bill, and that had that new information, which was even worse than what I thought. I thought 45% was pretty horrible, and to hear that it's 63% with a serious diagnosis, not just 45% with any diagnosis, it was like, this problem's getting worse, or it's worse in other parts of the state than it even is in Thurston. That's unconscionable, in my opinion.
I am familiar with that bill. Thank you.
1348, I believe, is that bill.
That's correct.
Commissioner Edwards, I think, has his hand up.
Yeah.
I guess I'd just like to follow up on Ty's comments there. For that whole 40-year career as a lawman, I saw oftentimes individuals that would end up in jail, and they'd lose that ability for that Medicaid assistance or whatever it was. And that made them twice as bad when they got back onto the street, then trying to get them back into treatment again. I mean, it was almost as if the system was intentionally trying to create more problems by eliminating that. So, I mean, it's taken that long. I've testified about that numerous times over the years, trying to get that changed, and it just didn't seem to get any traction. So I'm glad to see it's finally getting somewhere.
Thanks. Yeah, are there, at the risk of a free-for-all, I think we have time for a couple of follow-up questions from the committee. I see Wendy's ready.
Yeah.
Go ahead.
Yeah, I'm not sure if it's so much a question, but you know what, we, I don't know if there's anybody else that is taking such a look at the mental health services that are provided throughout the county as treatment sales tax, you know, and so a lot of the things that we talk about are things that are that are beyond the scope of the committee. For example, like why does the jail funding providing or determining managing the services versus having those be managed through, you know, the BHSA or what's their new acronym?
Yeah.
You know, yeah. And determining what services and are they evidence-based and those kinds of things. So a lot of the, and how much money, you know, we just get, we need money for this program, not, you know, they don't come to us and say, here's the continuum of care for behavioral health services in the county. And here's what we should be spending a certain amount on this population and a certain amount on that population and a certain amount pre-jail and post-jail, all those kinds of things. So we've been really trying to look at beyond really just how are we funding treatment sales tax. So what does that look like? And so I that's just some of the context about I think some of these questions and wanting to have some discussions that are, I think, beyond what we're necessarily being tasked to do, and also would like, you know, you to be considering some of those issues so that we can have effective, you know, behavioral health services throughout the county, and that we're really addressing issues of diversity, equity, and inclusion, you know, in the county, and those things are being paid attention to at somewhere in the county, beyond our committee mission. Focus.
Commissioner Edwards has his hand up, and I'll something that might be interesting to you based on that comment, and Commissioner Mejia. Commissioner Edwards and I sit on the governing board of the BHASO, and yesterday we had a meeting and we were discussing that there's a bill regarding creating like a 988 statewide crisis line, and the ASOs are getting some feedback on that bill. But, you know, obviously they like the idea in general, but what they're going to be proposing for exactly what you said, there isn't a comprehensive look at the crisis system and what the gaps are. So they're going to ask the legislature to slow down a little bit, put some resources into a total analysis of where the different gaps are, and then make the big investment in a more, you know, trying to meet those gaps rather than just slapping this sort of call line system on top of different pieces that are already there, and then missing other gaps in the crisis system. So there is a recognition that there isn't a comprehensive sort of analysis going on that probably needs to happen. Commissioner Edwards, go ahead.
I guess I couldn't hear all of Wendy. She was breaking up some. So I didn't get it all, but kind of like, why is the jail doing certain things? I know that I think all the jails around recognize that this recidivism is kind of the dumbest thing we seem to deal with as time goes on. And I can tell you that in my years as 20 years as running a jail, I did whatever I could do to try and break that cycle. And oftentimes we had programs like in the jail kitchen, and I'd put together a program with the community college. And at one time we had every restaurant in Thurston County had graduates from the county jail that had obtained a certificate through the community college, all about the whole kitchen process and how to work within that kitchen setting. And we brought in GED programs and stuff like that. So I think maybe traditionally jails have probably gotten a bit of a bum rap, like, well, that's just where you throw the guy, throw them away and, you know, put them in jail, throw the key away. That's never the way I've been exposed to jail operations, not only the ones I ran, but around the state and around the nation. And I'm not saying there aren't bad ones, there sure are. But I believe that's been an ongoing goal of all jail and correction operators, is to break that recidivism process any way they could, whether that was through a GED program or kind of a jobs training skill, whatever it might be. So I think it's been going. It just hasn't got much attention from the media that I'm ever aware of anyway.
Yeah, my point wasn't that we shouldn't be doing those. It was just where oversight should be, whether it should be, for those programs to have clinical supervision and support and oversight and decisions about programming.
So TST funds a lot of, a huge amount of the programming in the jail. And I think Wendy's raising this. Most of that money flows through the sheriff's office, and the sheriff's office contracts it out. Some of that money flows directly to the BHASO. And so trying to take a step back from that, are those the right pathways for the money with appropriate oversight for the different types of programs, some of which are more, clinical treatment services, some of which are less so. So those are discussions that we're having as a committee and talking about with those partners like the jail leadership and ASO, just about whether it's arranged in the most strategic way. I'm thinking maybe, I should move us to the next question, but of course, Commissioner Edwards, if you want.
Just a follow-up on that was oftentimes your professionals, yes, we do use that whole professional arena, but I'll refer back to a gentleman by the name of Mac McFarland that was a cook in the Army, and then I hired him when he got out. I'd never seen any individual that was, he didn't have any background in the treatment and whatnot, but boy, was he able to connect with those mostly younger people that end up in the county jail and get them back on a career path through work in the kitchen, through working with the community college. And so it isn't always a professional interaction. Sometimes there's lay people out there that just have the ability to make it work. He's since passed, sorry to hear, but boy, was he an asset to our community. So just want to pass that on.
Thanks. So the next question that the committee has been talking about for months now, so kind of issues of race and equity, diversity, equity, and inclusion. The board back in June issued a letter to the community, and the advisory committee had a lot of discussion about that letter and sort of what's the intersection with TST when TST programs came in asking for funds in the last budget process. This committee asked them to speak to their kind of philosophies and plans related to advancing equity. And so since that time, I think the committee was looking for thoughts from the commissioners on kind of where is the county going on these issues. There was, I think this committee was aware of the budget proposal for someone to lead that work at the county level that was not able to be funded. So in the absence of that, one designated leader, do the commissioners have thoughts on kind of where the county's work is going in that arena?
I might ask Ramiro or Shelley to kind of start off, and then commissioners could certainly pipe in with supplementary comments on that.
Yeah, and Carrie, the budget request that you stated, if you may, you probably not familiar with the conversation, but the conversation was creating a plan and creating an outline as to where we need to go in addressing racial inequities here in Thurston County. So a lot has happened. And in fact, Shelley and I have formed a group that we are developing an outline, both internal and external, that will include internal and external strategies as to how we're going to be addressing this particular very important issue. We presented that to the board, I believe 2 weeks ago in a planning session. And the board overall agreed on that approach, which included a couple of items that we're working on developing a resolution where the board may consider taking an affirmative action to declare racial inequity a crisis in Thurston County. And also the Board of Health is going to be stating via proclamation the importance of this element. Next to that is I'm working on revamping a resolution when the Board of County Commissioners created the Culture, Diversity, and Human Rights Council back in 1990. I'm going to be working with Kelly Mirno particularly and re-engineering that group. And the membership of that group has to be reflective of our community. And as you see this committee that provides key recommendations for the board to take an action and implement policy decisions, I envision this group will have the same conduit to the commissioners for the commissioners to explore implementing policy that will address racial inequalities in Thurston County. There's another parallel track to that we're exploring as to how we're going to be bringing training to Thurston County employees. And that is also a key element as to what we need to move forward. Where I'm sitting related to the training, I'm not interested in bringing a training that we can check a box and be completed. It has to be meaningful and it has to be intentional. So in related to the external, we're working with Thurston Thrive's Coordinating Council. They have been on the table from the beginning, and I appreciate that perspective. And that is going to be an initiative as to how we're going to be moving forward. To the extent the Thurston Thrive Coordinating Council was pivotal in bringing some suggestions as to how I believe the Chapter 11 of the Pierce County Comprehensive Plan, which is the public health element, included the specific areas related to this matter. So now it is part of our law. It is part of our code as to what we need to do. So a lot has happened in the last few months since the statement made by the commissioners back in June, and a lot of things will happen in this coming year. Hopefully that is helpful.
I think Ramiro said Pierce County by accident.
I'm sorry, Thurston County, sorry. That's my back history.
Kelly, did you want to add anything?
I don't have anything else to add. Ramiro did a really good job in summarizing all of the great work that's happening.
Commissioners, anything? I know this is important for Commissioner. He has made a lot of noise about this in her first couple of months on the board, and so opportunity for commissioners to pipe in.
So can I pipe in real quick? I just wanted to add, I mean, I think the commissioners were thinking about doing something really meaningful. We wanted to put basically, we didn't want something just to be words that we put out there. We wanted to put action behind it as well. And that's definitely a priority for me as a person of color. And so I'm very happy that we're on this track, and I know we're going to continue working on how really we can bring that diversity and equity in several areas of our policies. And I'm really excited about restarting this group that Ramiro mentioned and moving forward.
Go ahead, Wendy.
Okay, thank you. So when we asked the question in the proposals, I have to say that the responses that we got were pretty sophomoric and at times dismissive in their responses when we asked about diversity, equity, and inclusion from, well, we just serve whoever is arrested and comes to us, and we can't really impact, these issues about who we're serving, to just not even knowing how to address the question. I didn't see any systems thinking about how do we impact who's arrested. I know that that's not their necessary responsibility, but we just as a committee didn't see anything like that overall. So it was pretty disappointing, but not really surprising. So I just want to make sure that you have that feedback, that if it's going to be a priority, I think county really needs to be looking at some of those systemic changes in policy about how current arrests or policies impact people of color and people who are mentally ill more readily than people than us white privileged people.
Could I add an additional perspective, Commissioner?
Yes.
Related to that, Wendy, yesterday, Commissioner Mejia and I attended the Regional Housing Council. And just as a council that we're going to be addressing the homeless and housing needs in Thurston County at the regional level. Every year we issue a request for proposals where we receive obviously proposals as to how we're going to be issuing grants to the nonprofits to achieve the main objectives of homelessness and all associated with that. We went through the rating criteria yesterday, and we added diversity, equity, and inclusion as one key element as to how we're going to be allocating that. So perhaps you're right. I hope is the return to those proposals is not dismissive, because there is a point criteria that will be assigned as to how they plan to address this particular matter. So there is a lot of aspects how the county is going to be including that in a way that we're going to be addressing the issue. It comes with funding associated with it. So additional perspective.
I would just throw in that, having the data to back up some of the conclusions is really important. And there's a number of strands that are kind of hopefully coming together in a parallel fashion to help us do that. So I'm sure that your group has probably heard from Pretrial Services, Marianne Clear, about the APPR program, looking at that. So that's doing an analysis that's going to help us know kind of where we stand. At the same time, for somewhat unrelated reasons, the public defender and the county prosecutor are changing to a new software platform, and they're using a joint platform that will be able to share information. E-prosecutor, e-defender, they're going to work together. And I've actually encouraged the prosecutor, and he has followed up on that to meet with some of the groups out there that work, like there's Measures for Justice is one of the groups out there. There's actually a couple of them out there. And he's had meetings to talk to experts about what kind of data, as we're building this new software platform that the county's investing in, what kind of data can we be, how can we dial it up so it gives us what we need, maybe aligns with some of the information that we're going to need through our APPR project. Maybe it's going to help us figure out, a whole host of things, diversity, equity issues across the system, like just being thoughtful and intentional about what information we're collecting, because these new software platforms allow things to be, once you dial it up and structure it, it becomes like automatic, and then you have all this powerful information that can be used to do analyses of where we stand. And when the data is there, then I think everybody feels comfortable moving forward with policy changes. But it's hard when you don't have that raw material to say that you're going to, sweeping change in some sort of a policy that you're not even sure the problem exists in Thurston County. I mean, depending on what the issue is.
So I'm wondering if that might be a good segue, since we're running low on time, to the last question that the committee wanted to hear about, which was the new criminal justice coordinator or program manager, and the kind of leadership vision for that new position and that role, and of course connections to TST, but kind of where that is going.
I'll go ahead and start, because this was kind of my brainchild at the beginning, that I got the board support for, and I appreciate them that. The idea, frankly, came from citizens who saw how effective you were, Carrie, just like Glenn said, at your job and your group, and how you put a very analytical lens on the treatment sales tax program and said, what, we have a $75 million criminal justice apparatus. Why don't we sort of have a higher level, why don't we have the same type of approach at that higher level across our criminal justice and looking for ways that we can spend less money and get better results, implement innovative practices, get new programs. A lot of times, we have an idea, we have a question, but we don't have the data to back it up. We need, we don't have that human being to go out and just kind of shepherd information to support changes in programming and work with the stakeholders. And so, I see it as everything from collecting data to back up ideas to kind of talking to different stakeholders and developing new ideas, looking out at other jurisdictions, seeing what's going on in other places and how it would or would not translate to Thurston County. I think it can be, there's a lot we can put on this person's plate, and time will tell what they'll be able to do and what the capacity of that person is. But I think there's unlimited potential for that person to improve our overall criminal justice system in terms of efficiency, productivity, forward thinking. Let's make the right forward steps, not the wrong forward steps. There's a lot of stuff going on across the country. It's really exciting, not just in the big cities. I mean, it started with Brooklyn, and stuff like that, but now it's spreading to other places that are more Thurston County sized, and we can really learn from that. I think you had something to add to that.
Yeah, I'm just going to provide the status of where we are in that position. Commissioner Menser, the prosecutor, and myself work on a job description that's finalized. So I'm going to be bringing an item for the board to consider creating that position, and that will be on their agenda of March 2nd. And after that, if the board approves creating that position, we will go ahead and advertise that. So based on the job description that has been created, as Commissioner Menser stated, it creates a lot of synergies as to how this position can be effective. And is not just going to be narrowly focused on one aspect. It's going to be broad and a scope. So I, myself, am extremely optimistic as to how this particular position is going to bring value to help us to move forward.
Commissioners, anything to add? Commissioner Edwards?
Yes, I guess I would just say that I don't have to say much more. You covered the topic well between you and Romero. So I think we've got a diverse board, and we've got a willingness to work together on different topics. I'm kind of a tough love guy. I make no bones about it. And I think there's a blend for all of that to come together. And I think Ty pretty much hit it right on the head on that topic. I think that question got answered pretty well.
I see Bob's hand is up, and then I'll go to Wendy.
Sure. I have three quick questions with regard to the position and the committee. What was the name of the committee that you're forming? And does that coordinator participate with that committee? And is there a veteran advocate on that committee?
What committee you're talking about, sir?
The one that you're forming to look at this issue of diversity and equity and what have you.
Yeah,
you mentioned the committee, but I didn't get the name.
Yeah, that is evolving. We don't have a name yet. And say that again.
Would that coordinator work with that committee? That's my question, I guess.
Well, this coordinator will work with many committees.
Okay, sure. I understand that. And do you have a veteran advocate that you're going to put on that committee?
We have not defined the makeup of this committee yet.
Okay, I would then put it in the form of a request. I would ask you to look at putting a veteran advocate on that committee. As you know, there are probably 30 to 35,000 veterans in Thurston County. When you add their dependents, I don't know what that really makes the veteran community, but there's a lot of veterans around here. And I would see that the issue of PTSD is probably added to the dimension of behavioral health around here. And so I would look at all that, and having a veteran advocate on the committee would certainly be another consideration that I would ask you to look at.
Thank you, sir.
When
Yeah, I just wanted to say, as far as responsibilities for your criminal justice lead, having them also look at diversity, equity issues in criminal justice would seem to be a priority.
Yeah, I think that's right.
Thank you for the feedback.
Yeah, thank you.
It looks like we are exactly at time, and I know people have full calendars. Sure, appreciate this. This was actually, we did some meet and greet and some meat and potatoes, so I think we had a pretty productive hour. You guys are all smart people with lots of different perspectives, and that makes for good conversations, and happy everybody could make it. Commissioner, do you want to close us out?
I think I speak for my seatmates, but absolutely don't hesitate to reach out, directly if you have an idea. And, we want to hear from, we have a lot of committees and we have formal meetings with some of them and other ones we don't. We always like to hear the input in whatever form. So never hesitate to, even if you just have a crazy idea you want to run by me, I'm happy to hear that and I'll always respond back. And Priscilla and I, for example, have talked on numerous occasions about different things because she attends some of the groups I mentioned, Opioid Task Force and the Innovative Justice Group. So she doesn't hesitate to reach out to me, and none of you should either. We're all working toward the same goal, which is a better system. And welcome to the new members, and good to see some of the familiar faces from last year back.
And thank you all for what you do.
Yeah, thanks for serving.
Yes, thank you.
Thank you.
All right. Thanks, everybody. Have a good rest of your Friday.
All right. Bye-bye.
Bye-bye.